Hello, everyone. Welcome to Play It By Ear, the podcast made for students by students, where the more we know, the more you grow. My name is Aryan. Today I'm joined with Chuka
Hi everyone.
and Ashwin.
Hello.
And today we'll be talking about the environment and its effect on healthcare, and the opposite. But before we start, I wanted to talk about how this podcast has changed from the last episode, and we've come up with a plan saying that we achieve to educate an audience of members through casual passive discussion, providing insightful thoughts and conflicting opinions which you can recall and express. And we've changed it so that we can have shorter episodes to get more feedback and information into each episode rather than being constricted by time. Now I'll pass it on to Ashwin to start off hosting.
Right. So, as Ryan's mentioned, our topic today is about healthcare and the environment. Initially, these two things seem kind of distant. I mean, before COVID, arguably, environmental issues were probably the biggest issues that were like facing the world at the time. Um, then COVID, and then now healthcare kind of has. But I think it's actually really interesting the ways these two things interact in ways you might not expect. And I think it's just going to grow increasingly relevant as I guess the world progresses and environmental issues aren't. There isn't significant changes being done to accommodate for them. And so, yeah, that's what we wanted to talk about today. Um, so I think the first thing you want to ask is, I mean, how is healthcare affected by, the environment? Um, Chico, what did you?
Yeah, and so health, healthcare, health and the environment. It's something that maybe your everyday person wouldn't connect together, but really they're both influenced by each other. For example, someone doesn't tend to think about when it comes to extreme weather events such as flooding, wildfires, hurricanes. People don't seem to think about maybe the long-term health effects. So with flooding, for instance, some research has been carried out that has shown that flooding and long-term mental health issues are actually linked together, and that experiencing such disastrous events can negatively affect one's long-term mental health quite greatly. They can suffer from illnesses such as PTSD. This can also lead to other psychological illnesses such as psychosis as well. And identifying this relationship and making it more aware to the general public, I think, is important in people's approach to treating some of these illnesses. Other more direct illnesses that relate to weather events include the emergence of the emergence of um, viruses and diseases that are linked to mosquitoes. As the rising temperatures and the global temperature increases, mosquitoes will become more prevalent within the UK. Currently, we only have 30 mosquito species in the UK, but as the temperatures continue to increase, we'll find that the UK population will become more susceptible to Western born viruses such as the Zika virus and the Western Nile virus as well. And then I guess finally is the main one, air pollution, and the issues that come along with that, such as cardiovascular disease, um, difficulties with breathing, to at risk groups such as those with asthma, and finally, certain illnesses that people may not have thought of initially as well, such as dementia and long term cognitive impairment.
I mean, to touch on the thing with air pollution, I think a topical discussion would be the idea that there was this situation that happened where a child had died with asthma, and I think this was in London, and the coroner reported that this one of the contributing factors was air pollution, and I think that's really interesting because it shows how much of an influence medicine can have on like industry in itself, because I think the coroner reported that something needs to be done to change the law to try prevent further deaths happening because of air pollution. I mean, what do you think about the influence of health on medicine on the environment, do you think we can change things as doctors and healthcare workers?
Think that I think what doctors can do is make sure that through their own findings and their own interaction with patients, they can continue to identify all of the ways that people are being impacted by climate change. And I think the most that they can do is just pose these findings and present these findings to governments and the larger bodies that actually have the power to make change and change things, because doctors themselves, their primary focus is to help the people, and they can't go about spending the little time that they already have trying to fight for a cause that isn't directly their own job. But what they can do is help provide the evidence, help provide the facts, I think anyway, to help reduce this issue.
Yeah, I think going off of that, I think, I mean, doctors and science themselves have quite a large amount of trust in the public. I mean, with the pandemic, that seems to have only increased, um, because integrity is something that's highly expected of medical professionals, and that gives them a lot of trust. And the idea of it affecting our health seems to be quite powerful. It seems that people haven't been that quick to respond to climate change. It doesn't. It feels like quite far away and far in the future. But I think imagery of health might be more powerful. Similar to what Chuka said. Um, I think I also want to touch on something that Aryan said about a girl dying from pollution. Um, I think in areas that are more economically deprived, it seems that like the effects of environmental damage and pollution are worse. And this isn't just on like say a national scale, but like on a global scale with um, you know uh, developing countries facing much more severe, either due to their location in the world or economic factors, much more severe impacts of climate change, such as things such as famine, um, which itself undermines immunity. I mean, so many ideas about the way how our nutrition affects our health. So I think having quite a global perspective on the issues of environmentalism and therefore healthcare
Yeah.
is important.
I saw something like that actually, which was quite interesting. Um, in terms of economics, which suggested that because of heat waves, many people from economically deprived areas were dying because of heat stroke, which could be avoided by something as simple as a fan, which these people can't go out of their way to afford. It seems like a luxury for them, which I think it's really interesting that um, we can avoid certain like major events by just certain cash injections or just the influence that we have as doctors. And I want to quickly touch on something Chuka said, which was about doctors having a role in providing evidence to support the government changes. Whilst I think that's true, I think I like to disagree with you on that a little bit. I think
Okay.
I think doctors have a real um, kind of a sphere of influence, like Ashwin was saying, but it's part of their job to also influence society, not just the one-on-one conversations we have with patients. I think it's part of that. Like it should be like 30-70 almost. And I
More
think,
social thing, you know.
yeah, I think they should be giving out information to people freely about using their medical advice. And people like Dr. Mike or high, great influences of the medical professionals have a role to play in terms of giving people information on what they can do to keep themselves safe from the environment even. What they've been doing with the pandemic is great. Why can't they do that with the environment? That's what I
Yeah.
propose.
I think Okay, so I think what you said is quite interesting. So what I think you mean is like we need it shouldn't just be doctors focusing on treating the patients, getting them better, and just handing over the evidence and never thinking about it again. Is that what you're saying? They
Yeah,
should be involved with the whole process of improvement and everything that comes along with that.
of
What I
course, yeah.
think is that those two roles, I feel like they can be different. I feel like there's a line which a doctor that wants to pursue using that evidence and spending their time putting it forward to all the relevant health bodies and governments that can make a difference, they can pursue that. But then the doctors that have to go out and actually treat patients and collect the evidence, I feel that they should also do that. And while I believe doctors at the core of it should be the ones doing this work, such as take, for example, Dr. Anthony Fauci. I mean, he, for the American public during the coronavirus pandemic, is a source of trusted information. They know that, for the most part anyway, that if he was telling them to do something, that they could trust what he was saying. And I feel like and the type of doctor that he is the type of doctor that I'm saying is the one that is supposed to get the evidence and then put it forward to the right governments. And then the doctors that will be working, not to say below him, working with him to provide him with that evidence are different to that.
Hmm.
So while doctors should be the ones to do it, I don't believe that, I don't think anyway it would be feasible for just a doctor to do everything, like do it all together.
I think that's
Yeah.
fair. Ashwin?
I think, yeah, I think this is kind of quite an interesting point. I guess it's a discussion about what are the boundaries and like how much can a doctor be expected to do? So, advise, because I think earlier you were talking about complex socioeconomic issues. That just not having enough money. I mean, is this something that a doctor can do? I mean, they can say how it can be and how it can help. I'm just bouncing up and down a lot, but it's what's too far. I think the time and pressure that's needed for it I mean, they're already quite stressed, and going further than that. But then I think Aaron also brought up a really interesting point about the social side of it and the actual place doctors have culturally and their history. I think before we were talking, Aaron talked about organization during the Cold War, and I thought that would be something that might be really interesting to bring up now because,
Mm.
um, but basically the ways doctors have an influence on uh, political and social
Yeah.
issues.
I mean, what you're talking about is the International Physicians for the Prevention of Nuclear War, right? That was what I was talking about earlier. And basically,
Yes.
I read somewhere that this organization was responsible for helping to change public opinion in the sense that public almost were for nuclear war during the nuclear tensions between certain political countries, and they took scientific jargon that the campaigners were using, such as 10 joules of nuclear force or something, and translated that into something that the public could apply to themselves, which in that sense would be a skull fracture. Which obviously doesn't sound good when you talk about it medically, and which is why I think that they were instrumental in changing how society perceived nuclear weapons and nuclear war, because around that time we were introduced to many peace protests and people believing that nukes are never the option because of doctors like those in this um, society. So I guess this
How
can be
much of an
applied.
effect? How much of an effect did you say it had? Did you come across like the impact? Like, I mean, it's kind of hard to tell in these complex historical political situations, and like,
I don't know
um,
exactly, but I feel like what probably would have happened is them providing the information to the public exactly of what's happening, and then based on that information, they decided, oh, okay, things are not getting.
tangible.
Yeah, exactly, and then creating protests and kind of creating this ripple effect almost of people
Yeah.
understanding what's going on. But
I guess like part of the component of that overall anti-war and anti-nuclear movement. I think yeah, I think that's similar to what I was saying earlier about. I mean, yeah, what does it mean? Global temperatures rise by 2 degrees. What does it mean if there's more extreme weather? Okay, no, it's like more tangible. Like, oh, you're gonna have so many diseases that we've just never seen before from the south. You're gonna have or north, more tropical areas. Sorry, you're going to be having more um, economic hardships. You're going to be you're going to be getting more respiratory diseases, heart conditions. Your red meat's going to give you cancer. Of course, that's not directly related, but I mean, cattle farming is a massive um, component of global warming and air pollution. So,
Mm.
in addition to water wastage and land usage, deforestation. Yeah, I'm going to go on forever if I talk about cattle. It is pretty dire.
No, I mean even about what you're saying with the sheer number of diseases that we just don't know that we could be vulnerable to. I mean, they're literal super viruses that have been dormant in sea ice for millions of years. And with the thawing of the ice, do we know that the next global COVID just may be a droplet in an ocean of viruses that
Yeah.
we've never seen before? And are we prepared for that? How do we prepare for that? It's like, how do we prepare for something that we've never seen before? That's really one of the big issues. Well, it's one of the big things that I think about, because you can see how that this virus has impacted us, especially considering that the SARS viruses, that strain of virus, isn't even new to us. It follows the same structure as the common flu. So we already had some of the research put in place to build a vaccine quickly and effectively to fight off this virus. But something that we've never seen before, I'm not sure. I just don't know how we'll do it.
Yeah, you brought up a really important point because COVID, I mean, as because of urban expansion, we're going into more jungle areas, we're exposed to more animals, and a lot of diseases come from animals in a process called zoonosis. So, chickenpox is an example, I think smallpox as well, but Ebola, that's from bats, and people think that COVID as well. I mean, everyone remembers the bat jokes. That itself was likely from wild animals. So as we expand further, as climates change and more diseases from animals are exposed, COVID was bad enough, but I don't think these are going to become more frequent. So yeah, and I think this might be another point that we could market off of. I mean, I can't believe I just used the word market, but message off of. Um,
Mm.
I really do think there needs to be a big political shift and movement from to force powerful people to do something about
Mm.
environmental issues.
Yeah, I mean, this is based on touching on that, like forcing people to make a move on. I was thinking about the fact that our population is reaching 8 billion soon, right? I don't
Mm.
know how soon, but like it will come in the future. But
Mm.
how easy is it for us to influence 8 billion people towards one cause of climate change? And I mean, this touches on like loads of things, like socioeconomic things that you were talking about. But like, how do we do that?
I think that relies on mainly the strategies we put in place. It's not really about how quickly and how large the schemes that we create to spread information are, but just how smart we are about doing it. We found with the smart use of social media, all it can take is one or two, maybe just a small group of accounts to start spreading a certain rhetoric or idea for it to catch on and millions of people follow it. I mean, this is how so many false agendas are spread on the internet every single day. This is how false news is found on pretty much every single corner of Twitter, Instagram, Facebook. I think that if those methods of spreading information are used by the government or by the relevant bodies again, in a smart way, that I don't think that it should be a problem getting that information to those 8 billion people. Obviously, that again relies on them having a certain level of digital literacy and being able to access the internet. But again, I think that when you get to that problem, for the majority of people, you'll be able to reach them.
Mhm. I mean, touching on digital literacy, I was thinking, yeah, so we'll reach we'll reach them one day. Oh, Ashwin's gone, but we'll reach these people. But I was thinking about how in like lower socioeconomic areas, how can we force those countries who might not have the facilities to um, work with Western ideations of how we should stop climate change. I don't think it's feasible to tell a developing country that you should stop your um, you should stop your fossil fuels emissions because we're telling you now, because we've gotten to a stage where we can rely without it. I think I saw a Kurzgesagt video on that, which gave me the information. I'll put the link down below. But yeah, uh, Ashwin, what do you think?
Yeah, I think one issue with what the Chico was saying was that, yeah, most people acknowledge that climate change is an issue, right? The difference between climate, like say anti-vaxxers, that spread through or online information, that's just then individuals will say, no, I'm not doing this. But the problem is with climate change and environmental issues, individuals are kind of powerless, and that you need like it's pretty easy to sit at home and go on your phone or whatever and spread messages, but like to take actual political action, to like, um, you know, they've been, I mean, governments have been so, I forgot what the word is, complacent about all of this. So
I mean,
that
we had
you know,
COP26 recently, right? Or
Yeah,
26.
that recently
did anything
happened,
happen from that? Did anything at all happen from that?
I'm not sure. I mean, I wasn't looking
I,
at the politics
Yeah,
at the time.
I mean, honestly, I can't speak because again, I really didn't listen to it that much, but I think that almost speaks to the issue in itself, in that it doesn't even seem to be advertised to us as that much of a pressing issue that we have to focus on it, because it's not that I like I have a great interest in the news and knowing more about our environment and that whole issue. But when it came to that, I just found myself, I didn't tune in. And I think that also brings up the issue that it really isn't being told to people as that much of a dire problem that we need to sort out right now.
Hmm.
yeah. I'm gonna be honest, right? With a lot of this stuff about climate things, when I kind of just, I personally just don't like thinking about it because, um, I realize it's so depressing, and I can't do anything about it personally, right?
Hmm.
I think, at least in my current position, right? You know, just gotta know that, um, everything is going really badly, and then that, only if the rich and powerful do something, but it's not in their interests to do that. So, um,
I mean, we can talk about an organization that's trying to, or telling everyone that they will. Um, the NHS.
Yeah.
They said that by 2045, they want to have net zero emissions, and many articles I've seen based on that have taken surveys from the people, and it's a general consensus around, I think, 90 something percent said that they're willing to have a greener NHS, but obviously it's not the top priority, because most of them say the top priority is waiting lists and things like that. But
yeah. I mean,
also,
what does having a greener NHS mean for the patient, right? I mean,
yeah,
yeah, okay, fine. What impacts is it going to have on my drugs, healthcare?
Me, the
Yeah,
NHS,
well,
I feel like, sorry, Ari, just quickly, I just feel personally like the NHS shouldn't be I'm not sure what the figures are on the contribution the NHS makes to the green footprint every single year. But I just feel like out of all of the companies in the UK, for example, the NHS really shouldn't be that high up on the list for changing what they already do. I mean, the NHS is already a body that struggles with its resource distribution and everything. I feel like putting more restrictions on what they can do is just going to make the lives of people that work within the NHS harder, if you ask me anyway.
I mean, I'd like to touch on that a bit. I think um, we are getting a lot of money into the NHS generally, comparatively to other things, because obviously it's one of our biggest health services. But we lack in certain areas, such as funding. Sorry, not funding. Well, yeah, and funding for things that we definitely need. So,
staffing.
yeah, staffing. I definitely understand what you're saying, but I saw another article which said that the NHS releases as many emissions as Denmark, which I think is crazy. Like, surely there must
Yeah,
be something done. I mean, we were
a
talking
lot of
about
medical
this.
waste.
Yeah, the COVID
Medical,
thing you were talking about, Chuka.
so many masks.
Hmm.
You want to talk about the masks and the mask and the plastic waste and the just you know all these resources are expensive. Healthcare is expensive. Running a massive organization is expensive. And lots of drugs themselves are like environmental pollutants, like aerosols and say Ventolin in asthma pumps can cause quite a lot of damage or contribute to the global warming.
Hmm.
But I guess I think it's to see how more details about how it's going to play out, I guess, and what plans they have. Because I think all organizations are going to be working towards being greener, but I don't think it's happening fast enough personally.
The feasibility of a net zero establishment is very low, generally, if you think about it. Something like the NHS, which changes so much determining on what the healthcare situation is right now. Like, if you think about it, if we were to tackle climate change, in theory, the problems with emergency care that we have with people coming in because of the cold or the heat or maybe a collapsed tree, something like that, all those patients coming in would be technically negated. But there are other things that we just can't foresee when it comes to the NHS. Right. So, um,
Mm.
is it realistic?
I mean, it's what because there's so many avenues. This discussion. What realistic? The NHS's plans. I mean, if you ask me, I, I'm yet to see a single realistic plan referring to climate change and reducing emissions in general from most countries. To be honest with you, I think certain countries, maybe Japan, are maybe some of the closer ones. In France, they're pushing the Paris Accords, but uh, honestly, I don't know. I think there's the real answer is that I'm not too sure. The NHS has so many other issues that I feel that under the right circumstances and the right time, always they'll take prevalence over the issue of climate change.
Accidents.
It really does. It really does depend on It really does depend on the circumstances.
I think it is feasible. I mean, dealing with climate change in general. I mean, whether in healthcare or etc. But it's just so many things that need to be redone. Like that, it's so ingrained with the issues within our economic systems that users, how our structures, and like basically how the world works. That needs to be like changed um, and pushed, and things status quos need to be challenged, and um, whether that's going to happen, and a lot of that needs to happen in countries like say developed countries which have the global power, and I don't know whether it's going to happen. I think it's possible, but I mean, even within healthcare, I don't think. I'm personally of the opinion that the NHS's current organisation isn't sustainable and it needs a radical change, not privatisation, because I think that's the route it's going down now. But
That's unfortunate,
yeah,
though, isn't it? How we've worked so hard to have this free healthcare service, and it's world renowned, but it's it's kind of flailing in its own way, right?
yeah, I think it's interesting because it was set up a very long time ago, and how healthcare science has developed so fast um, that um, now it's kind of changed how healthcare works. You know, about acute and chronic conditions, aging populations, etc.
Mhm.
Um, yeah,
Anyway,
um, I'll, I'm not going to get into that now.
I think we've discussed like very in depth about all the environmental problems. I mean, is there anything else you guys want to add towards the end?
I don't think I have anything to add, but I think there is definitely more to explore and discuss, which I mean we'll probably provide links um, for the reading, and there's loads of it's a really interesting topic. I actually think, even if it is a little depressing, but yeah.
Hmm. Chuka, do you have anything to add? I know. You okay?
No, I think we've covered
Yeah. Okay.
pretty much
What we
all of it.
wanted to.
Yeah.
Well, thank you for listening to episode 2 of Play It by Ear, and this is the after show. Is there anything else?
Yeah. So
A laptop is dying, so I'm gonna have to dip.
let me add as well, like halfway through that, my earphones died, so I didn't actually. I heard what you guys were saying, but I didn't hear what you were saying because it kept cutting out every five, and that's why maybe some of the viewers may notice that my mic's changed now, and to how it was in the beginning to how it is now, and yeah, so sorry about that if it's affected the sound quality, but I'll make sure it doesn't happen again. Yeah, I was pretty worried, to be honest with you. I thought that I wasn't going to be able to continue, but I think I did it in a subtle way, so hopefully it's
I didn't
working.
notice.
Yeah. Yeah. Anyway, I mean, that was a draining topic in general. I think it's really changed
Yeah,
my
it's
outlook.
the climate. Oh my gosh, it's a bit, it's really,
It's a
it's a
bit
bit
bigger than you can actually
depressing.
think.
Mm.
Yeah,
It's
it's
a bit
pretty
of a
depressing.
depressing topic, to be honest with you. Just think like
Downer on a Saturday evening.
it doesn't just affect us, it affects generations and generations, generations after.
Yo, did you
Like,
hear that thing? There was that bill, right? That like I think it was the House of Commons or House of Lords who was saying that basically older generations shouldn't have to like foot the bill for climate adaptations because they're not going to see the benefits of it, which is just like the dumb. Oh my days! I'm gonna try
I
and not
didn't
get too
know.
political right now, but
I
oh
did
my
not know
word!
about that. But it's almost like that makes what's the justification for that though? Because if every
Oh, because
generation
I'm
takes
gonna.
that mindset, then nothing's ever going to improve. And then it's going to get to a point where the last generation down the line literally can't do anything about it because the situation has
We're
gotten
the
so
ones gonna
bad.
get screwed, man. We're the ones gonna get, and our children.
Mm.
No,
It's
I think yeah, I mean, if you ask me, I guess maybe some people will be feeling like, why is it us? You know, why couldn't it have been the people like 40 years ago that why couldn't they have been the ones to think about this before they started like the
Well,
mass
now they
export
have the thing. They're not
of
doing
oil
anything.
or
So.
coal or like all that type of stuff. And so that's what I feel like certain people may be feeling like. But if you ask me, it's an issue that's going to affect everyone, and it's something that we all need to work together to solve. So,
Yeah.
I think
Well, on that note,
the f-
I'm gonna head off because my back. I don't want to like cut off randomly. So, that was a good talk, and I'll see you guys at.
right. See you
yeah,
later.
so
Thank you for listening to
yeah,
Metacom episode 2.
Yeah.
And yeah, see you.